If you're watching this video, please keep in mind these instructions are for my specific patients that have had chin and neck liposuction with me. If you've had your procedure with another surgeon, please make sure you follow their post-operative instructions. With that said, let's get into what you'll need to do over the next few weeks to get your best results. After your procedure is done, you're still going to be numb and you're also going to start to swell. So because of that, we're going to put you in this little garment right here. Now this is going to be your friend for the next 5 to 7 days, depending on what we discuss and what we agree on. But here's how you're going to put it on. First off, you're going to find the little seam right here, and that goes right in the center of the chin. All right, next up goes across the top here, and then there's a secondary one right back here. Put that on nice and snug. And then wrap it around the back of the neck. Now, this is a little seated far back. What we want, especially in this brand that we have, we want the ears to kind of come through the holes. So what you're gonna do is you're going to bring the garment forward, let the ears pop through each side of the holes here. And then if it feels kind of loose, you can tug this down, readjust as needed. You're gonna get the hang of this very quickly. Now, if you have a ponytail or anything like that, the ponytail can either ride high or a little further back on the back of the head, and it'll be way more comfortable for you. So after you have your garment on, you're gonna be escorted back to your exam room where then you can change back into your button-up shirt, and then you and I will go over your post-op instructions again. Once we're done, you're gonna be escorted down to your ride home. We do not allow patients to drive home after their procedure under any circumstances. We likely gave you a sedative to help you relax during your procedure, so that makes it where you cannot drive for about 24 hours after. When you get home, please make sure to take your antibiotics and pain meds on schedule as listed on the bottles. I want you to use the prescribed pain medications for the first 24 hours at least, and then from there, depending on how you feel, you can then begin to transition to extra strength Tylenol as tolerated. Most of my patients tell me that they're off their pain medications by about day 1, maybe day 2 at the most. But you have them, so if you need them, I encourage you to use them. Your compression garment will need to be worn night and day for about 23 hours a day for the next 5 to 7 days, depending on what you and I discussed before you left the office. This garment has 2 roles. 1, to help your tissues reattach to the deeper structures, and 2, to help prevent the collection of fluid in this area. Your body hates empty spaces, so it's going to try and fill that space with fluid. If that happens, then your recovery may take a little longer to see your full results. For the next 3 to 5 days, you can apply ice packs or even bags of frozen peas wrapped in a small towel to your neck and chin region for about 10 to 15 minutes at a time, about every hour. You'll end up applying this over the compression garment, but I still want you to have it wrapped in a towel because your neck will be numb, and if you leave it on for more than about 15 minutes, we run the risk of getting some frostbite in those areas, which is not good for your skin. If you experience drainage from the incisions, that's actually normal and actually a little welcomed. It will help all that fluid that I injected underneath your skin to drain and allow your swelling to pass a little sooner. When you go to bed the first night of your procedure and for the first 5 to 7 days after, I want you to sleep on your back with the head of the bed elevated. The reason being is that I want the best chance possible for all that swelling to drain down. To do this, you'll need to set up 2 to 3 pillows behind your head, and I suggest putting a towel down over your pillows and then one of the blue and white absorbent sheets that we sent home with you. Make sure to place it with the white side facing up to help absorb any drainage at night. The next morning you can get up and take your compression garment off to take a shower. Your shower time is a good time to wash your garment in the washing machine if you need to, and then put it back on after your shower. So it's really the only hour out of the day that you really can have this thing off, and then I want you to put it right back on. After that, you'll need to put the garment back on so we can keep on top of all the swelling and prevent it from getting out of control. When you get in the shower, you can wash your hair normally and let soap and water run over the incisions without a problem. When you get out of the shower, make sure to pat your chin and neck area dry gently, as this area is still healing. Once dry, you can put the triple antibiotic ointment on the incisions from these little packets that I sent home with you. When you run out of packets, you won't need to apply the antibiotic ointment anymore. Once the antibiotic ointment is on, then I want you to put a Band-Aid over your incisions and then put your compression garment back on. You'll do this every day until the 5 to 7 days have passed, and then again, you and I will have discussed the exact amount of time to wear it after your procedure. So let's go into what your first week of post-op recovery really looks like. As you know, you're going to be wearing your compression garment 24/7 for that first week. You're going to be swollen and some bruising may develop during that week as well. It's normal for a ridge of swelling and bruising to develop along the bottom portion of your neck, but this is going to go with time and with some vigorous massaging as well. I want you to take it easy this week, but that doesn't mean laying in bed for 7 days straight though. I want you up and walking around, going about your regular daily activities, but that doesn't mean that you can go to the gym or do anything strenuous. Heavy lifting or anything that gets your heart rate and blood pressure up, I worry about increasing the risk of some post-operative bleeding, so just take it easy. So let's make it clear what you shouldn't be doing. No heavy lifting greater than about 8 pounds. A gallon of milk weighs about 8 pounds, so nothing heavier than that. No strenuous activity, so I need you to stay out of the gym and also keep your clothes on in the bedroom with your partner. Bedroom activities can increase your heart rate and blood pressure, so I need you to take about 10 days off from that. You're also going to want to avoid salty foods in the first few weeks after surgery so that your swelling can more easily resolve. Salty foods will make your body retain fluids, so that can take longer for you to see your results. On day 7, you're going to come back to the office and I'm going to check on you to see how your progress is going, as well as remove the sutures that are still there. After this 7-day follow-up, then you can begin wearing the compression garment when you're at home only for a few hours to help with the swelling further. I usually only recommend doing this for about another 5 days after this visit. Beyond that, the tissues are on their way to healing anyway, and the swelling is doing much better by then as well. You can also begin sleeping normally after the 7-day post-op visit. From weeks 2 to 3, you can expect the numbness in your neck region to continue to improve. However, in some people, it is going to take longer than this. One thing you may notice around week 3 is the development of a lot of lumps and bumps in your neck. This is totally normal and is related to the fat cells that have died in the neck after the liposuction. The act of just running the cannula back and forth through the neck will cause some of the fat cells to be injured, and then they eventually die, causing a bit of like an inflammatory reaction. This is totally normal and just needs to be massaged over a few weeks until they go away. From weeks 4 to 6, you can see these lumps and bumps we just talked about begin to resolve, and most of the swelling will have resolved by around week 6. You can also expect your incisions to be fully healed around week 6 as well. But before you get to your final result, which occurs around the 6-month mark after your surgery, we need to do a lot of massaging. And to learn how and when to start that, you can watch this video right here. I'm Dr. Paul Pearce, and I hope you learned something today. I'll see you on the next one.